far as community goes, the overall community, on a grander scale, that's always a little bit more challenging to get buy-in, maybe, and involvement from people who are just our community neighbors and friends and family members. It's harder to get people involved in talking about mental health who come from that group of people, your average community members, versus people who work closely with people who are maybe struggling with mental health. And I think that comes from stigma, first of all. And until we can break down stigma in our community about what mental health is and what it isn't, and make people aware that every one of us has mental health, until we can get there, it's harder to get just your average person involved in the conversation about mental health, because it doesn't necessarily affect them, it affects someone else. However, people who work in helping people who are struggling with their mental health, they get it. They understand that there are a lot of people from a lot of different demographics that are struggling with their mental health at any given time. But most of us who are just your average community members don't necessarily recognize that we all have mental health. It's something that someone else experiences. Until we can get to that point where we break down those stigmas and help everyone understand that it affects me and it affects you and everyone else in the community. There's that one of the key messages with our Rural Mental Health Network is that mental well-being is deeply connected to the wider community mental well-being, and that really is true. So when all of us feel a little bit more mentally healthy, that affects the broader community and vice versa. The more mentally well collectively we are as a community, the better off we are as individual community members. I think we've had an increase in awareness. I think the message that all of us have mental health is getting out there. And I shouldn't say I think, I know it is, because I have conversations on a daily basis almost with people who are maybe for the first time in their lives, and it could be because of COVID and the stresses of COVID, recognizing that they have mental health. And one of the things that I think has helped us as a community group is shedding some light on the mental health continuum model, which has been kind of a focus for us in our community, is with that continuum model, it really does allow people an opportunity to understand that they do sit on that continuum at any given time of any given day. No matter their age, you fit in there somewhere. And if you have more green days than orange days, great. But recognizing what a yellow and an orange day look like on that continuum model, and then being able to take a step back and say, yep, I'm being affected by whatever is happening to me and I need to take a step back. So just that in and of itself, recognizing that you sit on that continuum model with your mental health, and kind of doing those mini self-assessments on a daily basis and saying, yep, today's not a really good day for me, or this isn't a really good time for me, and these are some of the strategies I can use to make myself more mentally healthy. Just that awareness has been I think has had an impact in I don't want to say the whole community, but certainly people who are taking time to listen to their mental health and read about mental health more and access some of the resources that we've been offering to people in the community are, I think, more aware of where they're at right now. I think, again, the Corey Keyes model, just the message of the Corey Keyes model alone brings with it that reality, or that aha moment, if you will, that we all need to have, in recognizing that it's not just people with diagnosed mental illnesses who need to take care of their mental health. The whole languishing versus flourishing messaging of the Corey Keyes model was an aha moment for the people who attended our first couple of community input sessions. laying out the Corey Keyes model was, it was like a light bulb went off for people in understanding that people who have diagnosed mental illnesses can live very productive, wonderful lives. And yet those of us who maybe have not ever been diagnosed with a mental illness can really be struggling at any given time in their life and not have the quality of life that someone who has a diagnosed mental illness might have. So it's not so much as a movement to expand the Corey Keyes model as much as it is to use the Corey Keyes model to just send that message and awareness. And it's when you go through the Corey Keyes model and you understand it, it's quite amazing. It really is. It just seems like a switch gets clicked.